Hi, I'm Dr. Tom Hendrickson, and I want to show you one of the techniques we use in Hendrickson Method for the shoulder. The pattern in the shoulder is that it pulls forward in dysfunction, forward head posture and so forth, or after injury, as well as internally rotates to protect the shoulder. And so I want to show you how we move the shoulder back and externally rotate and unwind it. All right, so first of all, we're going to address the pectoralis minor. So it comes from the third, fourth, and fifth ribs up to the coracoid process here. And I'm touching this on Luke's, a little tight here. So I'm going to do some muscle energy technique, a contract relax technique. So I'm going to be pushing down toward the table, and I'm going to give a little cue here to Luke, and he's going to resist me. So resist. So we do that for about 5 seconds, and then relax. And now, Luke, you relax. I'm going to push this back toward the table. Exactly. And then I'm going to push again. Luke, you resist me. So this is a post-isometric relaxation. We're lengthening the pec minor now. And then relax, and I can push it back. Now, Luke, hold it on the table. Don't let me lift it off. And that contracts the opposite muscle, which sends a message to the muscle in the front to relax in this lengthened position. Now you can relax. So then what we want to do is these muscles, as I described here, like the deltoid muscles, they're rolling into this internally rotated position. So I want to externally rotate. I want to unwind these tissues to open up the shoulder. So I'm going to bring the arm off the table a little bit. It's just relaxed. I'm going to put my relaxed hand on his arm. So my thumb is about the midline of the arm. And then I'm going to externally rotate the shoulder as I unwind the tissue. So I'm sinking into the tissue and I'm unwinding it this way, making sure he's relaxed. So we do it again, this way, unwinding it like this. And we go down the arm. I could go back to a little different position here, a little bit more posteriorly. I could come back more to the midline, unwinding these muscles here, deltoid, and of course, what's if we go deeper underneath the biceps, even the joint capsule if we get deep enough. And once we've done that a little bit, then finally, I'm going to do a little anterior to posterior glide because the humerus gets stuck or fixated a little bit forward. So I'm going to abduct the shoulder. I'm going to lift it off the table a little bit. I'm going to put my palm over the head of the humerus, and then I'm going to gently push it back toward the table. This is an anterior to posterior mobilization of the shoulder. All right? And so that is one of the techniques we use in Hendrickson Method for the shoulder.